Have you been told to do this exercise for your low back pain, but it's really not working for you? And it actually makes you feel more pain in this area or this area? Well, we're going to do a variation of that exercise today to actually make it work better for you. I'm Sebastian, and this is Don.
Hello.
We are the locally world famous chiropractors in Costa Mesa, California. Locally world famous.
You gotta sing it.
Locally world famous. And we're going to go into the exercise right now, and I'm going to be the subject. Don's going to give me some variations.
Cool. So show us the original exercise and how most people perform it.
Okay. So I'm going to move my hands just so you can see, but usually I think they have their hands at their side.
And so I think the thing in this one is really trying to kind of open up the back, maybe feel a stretch on one side as you go to the other side, feeling like you can get your knees a little closer to the floor, and maybe somebody has told you to just work within the range that feels good for you. And so, I mean, this works for some people, but what you may notice is actually as you're pulling yourself back or as you're resisting the weight of your knees going down, you feel the activation in your spine or in the muscles on the backside, which is what we don't want. We need other places working. So I'm going to give you one simple cue in this one. Let's go hands out wide, Seb. And what I want you to do is try to push the palms and the entire arms into the ground as you're rotating. Perfect. At no point should I be able to lift up your arm. And at no point should I be able to lift up your arm as you're going down. Use the hands to push your legs back. Good. Resisting, resisting, resisting. Use this to push back. Perfect. What do you feel with this?
I feel my belly working.
So that's exactly what we want in this one. Instead of spinal muscles helping you go from one side to the other, we need belly working in this. We need to get the effort away from the spine altogether. So this is a simple modification you can use. Use the hands, gets the belly active, and we don't have to change anything else about the exercise. If this doesn't seem to work well for you, maybe you have something going on up through the arms that this just doesn't feel comfortable, we can change this again by, let's bring the feet up off the ground. Good. And then I want you to try to rotate here. This is a lot more challenging than the other way, but again is another form of forcing the abs to do the work in this exercise instead of the spine, the joints, the muscles on the backside.
You mean the core is important?
It's very important.
Okay. Actually, it's funny doing this. It actually slows me down too. I'm not going super fast. And it's, I don't know if you ever feel this, but going this way, I kind of feel like, should I just do it? Should I just
like
pop myself? It just feels like it's, you know, and doing it with the hand pressure becomes a lot more effortful, and I don't really even think that thought.
Yeah, you don't even really feel like you're wanting to pop anything or feel the backside working at all. What if they feel back pain in either lifting the legs up or feeling like maybe a pinchiness in the hips with this?
Yeah, so possibly then the rotational component is just too soon. This is an exercise that does work for a lot of people, and the variation works for a lot of people, but sometimes people's spine just doesn't tolerate rotation yet. I can imagine somebody who's still stuck on the floor because their back just went out yesterday. This is not something you should be doing on day one. There's a lot of other things. And so this plane of movement, the twisting, there's an intolerance to that. It will become tolerant again, but currently it's not there. And so when I mention intolerances, there's lots of different types of back pain that have intolerance to flexion or extension, and certain diagnoses will resonate well with flexion intolerance or extension intolerance or rotational intolerance. So the diagnosis is important, as well as knowing your tolerances, and we have some learning resources for you up in that corner.
Nice.
This would not go well in a flexion intolerant case because it's flexing the spine. But it's over there, and it's learning resources that we created for you guys to understand a little bit more about what's going on so you can make an educated decision about what to do and figure out how to decipher through all of these exercises that might be given to you that aren't really correct for you.
Yeah, absolutely. And if you guys are tired of ciphering through this on your own or following a sheet from your physical therapy office and you just want better guidance, we can help you in person, of course. If you're in the area, come and see us. That's always best. But virtual is an option as well, where depending on where you are in the world, reach out to us through the contacts below. Email is always best. We're helping tons of people virtually right now that are getting incredible results. So you don't always have to be here. We can coach you through this exercise virtually and find the right modifications for you or something different altogether.
Yeah, you know the cool thing about virtual is you don't spend gas money.
This is true.
That's a problem nowadays. So
More time in the car, especially if that hurts your low back too.
Yep. So we'll see you guys next time. Subscribe to the channel and like the video.